So I want to talk to you a little bit about what Area Agency on Agings are, what they do, and I also want to give you the good, bad, and the ugly on service availability and potential gaps. So if you're not familiar with Area Agencies on Aging, there are federally mandated entities that are across the country. Every state has multiple area agencies on aging that cover all of their counties. So Ohio has 88 counties, and we have 12 AAAs that cover those 88 counties. The AAAs were established in 1973 as part of the Older Americans Act because there was a huge need for services for the elderly, and there really wasn't anything at that point. So area agencies on aging, every state runs a little bit different, but they either do information and assistance or care management or both. And in Ohio, all of the area agencies on aging do both. So when people call in and ask questions, we provide lots of information and we refer them out to other entities in the community. And we also care manage individuals who are receiving services from us on the various waivers. So Direction Home, Area Agency on Aging, we changed our name recently, made it much longer, added the disabilities aspect of it, added Direction Home to it because, if you hear Agency on Aging, you automatically assume that we only provide services for individuals who are over 60. I know the focus of this GRC certificate is on the elderly, but we do like people to know that we do have services and things available for individuals of all ages, as long as they have a disability of some sort. So, and Direction Home, we felt that was really important to add to our name because the biggest goal of area agencies on aging is to keep people in their homes wherever that may be. So if they want to be in the community, we want to make sure that they can stay there as long as possible. So that's our number one focus, is to help people stay where they want to be. So Direction Home Akron Canton, we cover Portage, Stark, Summit, and Wayne counties. We're a private nonprofit. We have a board of directors, and we currently have over 230 staff. And I would say prior to COVID, we had over 75 volunteers. Right now, because we're not doing as many home visits and we're not in the nursing facilities like we usually are, we definitely don't have quite that many right now. A lot of our volunteers, I think, are on hold. So we still have some making some phone calls and things for us, which is great. We contract with over 310 service providers, and then we serve over 7,000 individuals on our waiver programs. So our mission and our vision, I'll just read those to you real quick, and I need to move this. I have you guys kind of, blocking my view here. Hold on one second. Figure out how to move the little faces around. Okay. All right, so our mission is that Direction Home provides older adults, people with disabilities, and their caregivers long-term care choices and consumer protection so that they can live the highest quality of life. And our vision is that we would be the central access point and the preferred long-term care management organization for people with all abilities or disabilities. And so all of that in a nutshell, we provide choices for people to live independently, like I mentioned before, in the place that they want to call home. So who we are, the vast majority of our staff, of those 230, are either licensed social workers or registered nurses. We also have ombudsmen, and we have a dietitian, and then of course we've got accounting staff and human resources, and then we have a full-time lawyer on our staff as well, and she is in charge of our compliance program. So she makes sure that all of our contracts that we have with governmental agencies and managed care organizations, she makes sure that we are meeting all of those contracts. And she's also what I call our HIPAA police. So just a quick little overview of our core services that we offer. If you start with the lower left-hand side where it says Aging and Disability Resource Center or Information and Assistance, we call that our front door. So anytime someone calls into our agency, sometimes people stop in, not very often. Usually it starts with a phone call, and they will be routed to our Aging and Disability Resource Center. And an individual, for example, may call in and say, I'm struggling to afford food, or I'm struggling to be able to prepare my own food. Are there any programs that I could qualify for and receive meals? So that individual, the screener who answers the phone, will let them know about the different meal programs that we have to offer, anything else that's available in the community as well. We keep a huge plethora of resources, community resources, so that we have those available if individuals call. And they not only will link them with meals, but they might also ask them questions to see if there are any other needs that they have that we could help with as well. We have nurse assessors that will do free assessments in the community or anywhere the individual is. We do assessments in hospitals, nursing homes, assisted living facilities, group homes, pretty much anywhere as long as they actually have a home. We unfortunately can't provide services for individuals who are homeless. They have to have a place to receive the service, but they can live with a family member or a friend. So we have nurses that will go out and do free assessments to see if they qualify for any other services. So our main goal is, if at all possible, even though the individual might only currently want or need meals, our biggest goal is to try to get them on one of our waiver programs if at all possible, because that opens them up to a lot more services that will be available to them when or if they need them. It also provides them with a case manager who regularly checks in with them to see how they're doing and if there's anything else that they might need. So moving up to our Elder Rights Department, this is where our ombudsman program lives. And if you're not familiar with what an ombudsman is, they are patient advocates. So the majority of our work over the years has been in nursing facilities, but it has recently grown to be over, it's also assisted living, group homes, and it has also recently grown to be community as well. So anyone who is receiving services, whether it's in their home or in a facility, there is an ombudsman that covers that region that can go out and meet with those individuals. They provide education. They empower individuals to resolve conflicts on their own, if at all possible. But if it's not possible, or if they're unable or unwilling to advocate for themselves, that's where the ombudsman is very helpful, because they can step in and advocate for the rights of that individual as well. So they want to make sure when they go into a nursing facility, for example, that all of the residents know that there are certain things that, they have the right to have. They have the right to get up in the morning at whatever time they want to. They have a right to eat whatever they want, even if their doctor says they shouldn't be eating a certain thing. So we make sure that they know what their rights are and that the facilities are actually upholding those. If they're not, then we investigate those issues and we work with the facilities to fix those. Then moving on to our health and wellness, we have quite a few evidence-based programs that we offer to individuals who are over 60 in our community, and they're really great. They're a lot of fun. We have things like chronic disease self-management and Tai Chi, and I'll talk a little bit more about those here in a little bit. And then moving on to our home-based supportive services, this incorporates our case management program. So all of those individuals that receive services from our agency also have a case manager who meets with them in their home regularly, at least prior to COVID. I'll let you know what we're doing at this point during COVID, but generally we would meet with them in their homes, make phone calls throughout the year, and make sure that all of their needs are being met. This also includes our provider network, those 310 providers that we contract with. They're the ones who are actually providing the hands-on service for people. And then we have quite a few nutrition programs. We've got home-delivered meal programs and a restaurant initiative that I'll talk a little bit more about here in a little bit. And then we have a caregiver support program as well. So not only do we serve individuals who are over 60, or if they're under 60, they have some type of disability, but we also provide services for caregivers of those individuals as well, because we know that caregivers are super important and that they often get burned out and a little frustrated at times, maybe don't know what to do, or just some assistance or some support. So how we serve all these individuals, here are some examples. So each year we average over 12,000 callers that we provide information and assistance to. There's generally over 11,000 Medicare patients that we help avoid readmissions. Over 10,000 people each year are given that free assessment that I mentioned in the community. And then we have over 7,000 members that are currently on one of our waiver programs. We call those long-term services and supports. And 210 nursing facilities that we cover, like I mentioned, with advocacy, education, and then we also help with selection assistance. So if family members call and say, you know, mom and dad aren't doing so well, they're getting older, not taking care of themselves in the home, we're not sure if it's time to put them in a nursing home, and if it is, which nursing home do we choose? There are so many. So our ombudsman will help them make those decisions. Now, we're unbiased, so we don't say, oh, don't go to this facility, go to this facility. We're not allowed to give that type of information, but we can let them know what their current surveys have been like when the health departments have come in. We can give them access to websites that help compare and contrast nursing facilities. We can also give them a list of questions that they should ask each facility to make sure that they're making the right selection for the right person. There are not facilities that are, you know, better than others. They're all just different. So it depends on the family member's needs and what they're kind of looking for out of a facility. And I say 210, and I know I originally said we cover Summit, Stark, Portage, and Wayne, and that's for the majority of our services. But the Ombudsman Department is a little bit different. We recently acquired 2 other region Ombudsman departments as well. So we not only cover those 4 counties, but we also cover 9 counties in the southeastern part of the state and 7 counties, sorry, in the northwestern part of the state. So we cover a huge range when it comes to nursing facility and ombudsman type services. So we have a total of 210 facilities that we cover across the state. As far as professional programs, we also provide a lot of continuing education classes. So nurses and social workers, counselors, we have some that are approved for law degrees as well. So over 4,000 individuals a year, we're providing CEs or CEUs to. And then we average about 60 individuals in the community that we provide those evidence-based classes that I mentioned, like the Tai Chi. So who we serve, this is a little snapshot of the largest programs that we have, our waiver programs. So if you may or may not have heard of MyCare Ohio, that is something fairly new over the last, I want to say 4 years now. So this is for individuals who are dual eligibles. And what that means is they're on Medicare and Medicaid. And if you remember, so Medicare is generally for those over 65, and Medicaid is generally for those who are low income. So this is individuals who are low income, generally over 65, or they're younger with a disability. If they're eligible for both Medicare and Medicaid, they would be on the MyCare Ohio waiver if they needed assistance. And they have the choice. They can choose either United Healthcare or CareSource to receive their services from. They're both very similar in the type of care that they provide, but of course there are a few things that are a little bit different. So depending on the person, their needs, what medications they're on, that kind of thing, they can decide which entity they'd like to receive those services from. So as you can see, there are currently about 2,000 individuals that we serve on CareSource, and close to that as well on United. So that makes up the biggest portion of our 7,000 consumers right now. The next biggest program we have is Passport, and that's the program that we've had for the last 40 years. And that is one of the original waiver programs that the area agencies have had. And it is for people who are over 60 who are Medicaid only. So if they're not quite on Medicaid for some reason, they would be on Passport. Same types of services as MyCare Ohio, just a different waiver. So it's just a different funding source. We just have to kind of keep all those straight, and we have different case managers for each program. Assisted living is another waiver. It's on the smaller side at this point, but what's nice is if individuals are privately paying in an assisted living facility, they run out of funds, many of our facilities in the northeastern Ohio area accept Medicaid now, so they would be able to let that individual remain in the facility that they've been living in. They would just switch from private pay to Medicaid, which is a really great benefit. This is something we would love to grow, love to see more facilities accept. But at this point, there's unfortunately limited Medicaid beds available in assisted living. Most facilities, especially the newer ones, they would much rather have private pay, which we understand because the payment rate is, or payments are so much higher. When it's private pay, you can basically ask, however much you would like to charge. So it could be, $3,000 to $6,000 a month. But with Medicaid, the reimbursements are really low, unfortunately. And then we have the Ohio Home Care Waiver, which looks really small in this picture, 178 individuals on this program. And this is for individuals under the age of 60 who are on Medicaid. But this program is also case managed by another entity called CareStar. So CareStar and Direction Home, we kind of share that program. We get half of the referrals and they get the other half of the referrals for this program. And then Care Coordination, it's not a waiver program. So it's not a Medicaid waiver program. This is for individuals who are not on or eligible for Medicaid, but need some assistance. So they maybe have a little bit too much funding to qualify, but they still need some help. This program, because it's not backed by a waiver or anything with a significant funding source, we kind of have to cobble this together with lots of different grants or donations. And we do a raffle every year to help us earn money for this program. And we also, as employees, make donations to what we call our Care for a Lifetime program, which helps us to serve these 320 individuals. This program was much bigger just a couple years ago. We had over 600. And unfortunately, each year, as our funding sources kind of remain the same or sometimes drop off, the program is getting smaller and smaller. And I'll talk a little bit more about why it's really important to have these type of programs here in a few minutes. So I mentioned our provider network. The only way we can provide all of this help, all of this care to our 7,000 individuals is because of our robust provider network. So we currently contract with over 310 providers. This is not a full list of our services or our providers, but this is just our just a snapshot of some of our most requested services. We have home health agencies, home medical equipment, adult daycare, home delivered meals, and assisted living. So I'm going to get a little bit more detail into each of our programs and services. I don't expect you to remember any of this, but I know that you'll get a copy of the slideshow after the fact. So this might be a good resource to kind of refer back to at some point if you're thinking, is there something that this person might be eligible for? Obviously, we would just say, give us a call. We can do all of that for you. We don't want people to screen themselves out or, or professionals unnecessarily screen individuals out. And sometimes, people are very close to qualifying, and there are things that we can help them do in order to make them or help them be eligible. So, but this is just, for your information, all the different services and programs that we have and kind of the differences between them. So the first is our Aging and Disability Resource Center, our Information and Assistance Program. Like I mentioned before, we provide free information regarding our programs and services and other resource information that's in the community. So we don't always try to keep everybody, in-house and provide everything in-house. If we can, we will. But we also have many community partners that we know provide lots of services that we don't. So we make sure that we're directing them to those services as well. And this is for seeking long-term care services and supports or just information. A lot of times people just call and ask questions. But one thing that we do a lot of is helping people to know how to plan for their future. So if they're, someone getting a little bit older and they're just not sure, if something happened, what they would do or what they would qualify for, we can help people with their long-term care planning. Our Alzheimer's and our family caregiver respite programs. These provide a lot of the same services like our waiver programs, just on a much smaller scale. So they can receive, this is for individuals who have Alzheimer's or dementia, or they're caregivers of individuals with Alzheimer's or dementia. And the care recipient has to be over the age of 60. But if they qualify for this program, they would receive personal care, minor home modification, case management like our other programs, homemaker services, which the difference between personal care and homemaking is personal care services, they provide hands-on with bathing, dressing, things like that. The the ADLs, activities of daily living. And then homemaker would be more like cleaning the house or cooking a meal, doing some shopping, things like that, running errands for them. Adult day service is a really excellent service that we offer to individuals on a lot of our programs. And this is great for people who don't want to sit at home all day by themselves, who would like to have interaction with other individuals who have, the same age range or similar interests. It's also great for people who cannot stay home alone, and their family members maybe work outside of the house. So this is a safe place for them to go during the day while their caregivers are at work. And then transportation used to only be for medical appointments, but now we also have non-medical transportation available in a lot of our programs as well, which is great because it can get people to the grocery store or to, if they have to go to Jobs and Family Services or anything like that, we can help with transportation. Our assisted living waiver is for individuals 21 and over who are on Medicaid. And they have to have a need that's somewhere between community-based and nursing home level of care. And with that, they receive services that are offered within the facility, and then care management, of course, from someone in our agency, and community transition services. And community transition services, that is, something that's available to individuals who are in a nursing facility who are moving into assisted living. And what that provides them with are things like furniture, plates, pots and pans, things like that, anything that they would need to help set up their new home. Because a lot of times people in nursing facilities may have been there for a while, or they may have lost their homes. They might not have anything other than some clothing. So when they move into assisted living, those rooms are not always furnished, so there might be a lot of things that they need, and they might not have the money to buy them. So this is a great option for individuals who are moving from nursing home into assisted living. All right, assessment and consultation. As I mentioned, free in-home visits. They evaluate for eligibility of community resources, provide information, and help with that long-term care planning. Care coordination program, that's the one I mentioned before. That's not a waiver that we provide services for. This is for anyone over the age of 60 who's living in a home and community-based setting. They would receive a case manager and then very minimal services, a couple hours a week of personal care, or maybe home delivered meals, or maybe an emergency response system. They probably aren't going to receive all of those services, unfortunately. This is for people who are still fairly independent, who just need a little bit of help in order to remain in the home, but just don't have enough money to privately pay for those items. An emergency response system, if you're not familiar, is like the necklace or the bracelet that you wear that you can push the button if you need help, if you fall or if you get sick or something like that, and it calls 911 for you. Then we have our evidence-based programs, Healthy You and Steady You workshops. Like I mentioned, there's chronic disease self-management, diabetes self-management, matter of balance, and Tai Chi. And each of these classes are free to those who attend, and they are offered for usually an hour or two once a week, and they have different time frames. So one I think is a 6-week class, one's an 8-week class, and I think the other is like a 10-week class. But these are for older adults in the community. Generally, prior to COVID, they were all in-person workshops. So we would set up in a senior center or an apartment building in their community room, in a library, wherever we could find a space, and we would invite individuals who are interested in attending, and they would come, they would receive a free workbook, and one of our trainers would go through the training with them each week. They're all a lot of fun. They're all active. So you would get up and do some light exercises and things. It's teaching people to be more confident in moving around in their spaces, teaching people maybe some ways to be more active at home so that they're not falling or concerned about falling. And Lori Smith, I know she's on our master trainer, and she said that we have workshop groupies. So we have individuals who sign up over and over again for the same classes because they have so much fun and they enjoy it so much that they once the 8 or 10 weeks is over, they sign up and do it again. So it's a lot of fun, and people really get a lot out of it, and they seem to be a lot more confident once they've gone through the classes, which is a huge battle in fall prevention, is just having that confidence. And then we have our long-term care ombudsman program. So this is our consumer advocacy. We help with selection of long-term care facilities, and it's for anyone in the community who's looking for some information. So whether it's the individual who feels like it's time to find some help, they're not feeling safe at home anymore, or if it's a family member, we'll provide assistance for anyone. Now, ombudsmen are consumer directed. So if they're meeting with someone in a nursing facility, for example, and the nursing facility is saying one thing, the consumer is saying another, we are always going to err on the side of the consumer. Even if they're being totally out of line, asking for something, that the facility is not able to do, like they want steak and lobster every single day for every meal, we're still going to advocate for that individual. That's the role of the ombudsman. So, obviously, that's going to be a really hard thing for us to actually get for the individual, but maybe we can get it for them every once in a while. Maybe we can come up with a compromise or some happy medium on both sides. But we're definitely consumer directed. So if an individual tells us, hey, something's going on, but I don't want you to do anything about it, I don't want you to say anything to anyone, excuse me, we can't do it unless they give us permission. Give me 1 second, guys. I want to cough in your ear. I don't know how to mute myself now. My allergies are really bad lately, so I apologize. Okay, so MyCare Ohio, this is for anyone over the age of 18, Medicare and Medicaid eligible, and they must need at least an intermediate level of care. An intermediate level of care is the level of care that you must meet in order to be nursing home eligible. So if you're eligible to be in a nursing facility because you need help with some of your activities of daily living, like bathing, dressing, grooming, eating, feeding, things like that, ambulation or transferring, things like that, excuse me, then you would be eligible for our waiver programs. So even though individuals might be at a level where they could actually live in a nursing facility, we know that not everyone necessarily needs to be there long term, that some individuals would be just fine in the community receiving some care. So I don't want you to think that Area Agency is against nursing facilities. Some of our staff are on the board of nursing facilities. We partner with them for various things. We know that they're a very important part of our society and that there is definitely a huge need for them. But we also know that some individuals really don't want to go there. And if they can be safely sustained in their homes, in the community with just a little bit of help, then we want to make sure that we're doing that for them as well. All right, our Ohio Home Care Waiver Program. So this is for individuals under 60 who are on Medicaid. They have that same intermediate level of care or even a skilled level of care. And those are the services available for them. Nursing, personal care, skilled therapies, home modifications, assisted devices, emergency response, and adult daycare. Passport, this is our waiver that's for over 60, also on Medicaid, also intermediate level of care. And those are the services available for them. And then specialized recovery services. This is something that's fairly new to us within the last few years. This waiver is for individuals who are 21 and over and who have a history of behavioral or mental health diagnoses and issues. Sorry, guys. They receive case management, and we call it recovery management, in individualized placement and support. So if they need some assistance with finding housing that's adequate for them. And then there's peer recovery support, which is a huge piece of this process as well. This is a very small program that we are running right now, but it's really It's really interesting, and it's a lot different than anything we've done in the past. So it's really kind of neat to be able to provide services for people who might be very independent physically, but just, might need that support because of behavioral or mental health issues. And then last but not least, our transitional care program. So we have nurse assessors, and we call them transition coaches, that go to the hospital and meet with individuals who are currently hospitalized, and we provide them information. They do a coaching event, and the whole goal is to empower people to be more independent and to also be able to take charge of their self-care. So we want individuals to know that they can set their own goals, their own health goals, and talk with their doctors about those so that their doctor can help them reach those goals, rather than being passive and just sitting back and letting someone say, you need to do this, you need to do that, you need to take this medication. We want them to be more engaged and to say, I don't really like this medication. I don't like how I feel when I'm on it, or, just to be able to have those open lines of communication. The coaches will actually sit with them while they call their doctor. If they're concerned or afraid and don't want to have those conversations, they'll sit with them and help them make that call. They do a lot of role playing. They do medication reconciliation with them once they get to the home. So they start with them in the hospital, and then they follow them to the home once they transition, and they'll go through their medications list with them. They'll go through their discharge paperwork and make sure that they understand everything that's on it. So they try to bridge that gap between individuals who are discharged from the hospital and then going home, because a lot of times people don't have that that resource or that person that helps them make sure that they understand everything. When you're in the hospital, you're not feeling good, you're probably pretty stressed, and there's so many people in and out telling you so many different things. So it's nice to have someone that can kind of help you weed through all of that and figure out, this is what's going on. One of the other things that I think is hugely valuable that the program does is they help individuals to recognize red flags. So if they're, someone who has COPD and they're starting to feel short of breath or having some symptoms, instead of waiting until those get really bad and then calling 911 and going to the hospital, they encourage them to, contact their doctor's office. They encourage them to do some things first and early before just using hospital as a last resort. And then these individuals that we provide this coaching for are those who are on managed care plans currently. So our pre-COVID state, we were doing all of our visits in the home. No matter where that home was, we were meeting with individuals. Not obviously because of the pandemic and the stay-at-home orders. We've been asked by Ohio Department of Aging and the Ohio Department of Medicaid and our managed care organizations to not do home visits for the time being. That's really hard for us because we've always been boots on the ground. We've always been in the homes. We are really good at assessing the environmental situation and, kind of just like reading the signs when we go into the homes. So it's really difficult because now everything that we do is telephonically, or if we have an individual who's very tech savvy, we may do some visits virtually. Now, the great thing is, though, our service providers are still able to get into the homes. So even though our case managers and our assessors aren't able to make home visits, our personal care providers and those delivering medical equipment, things like that, they are still able to get into the home and assess the situation and make sure that individuals have what they need and still provide those services if the individual would like them to. We have had quite a few of our consumers say that they don't want anyone in their home at this time, so they haven't had home health aide or anyone coming in to cook or clean or anything for quite a while, and that's okay. They have the right to make that decision, but I know there's quite a few people who really truly could use that service again, so we're hoping COVID goes away soon. So one of the good things about the pandemic is that there have been so many different grants and so many different funding sources that have come to us because of it, which has been awesome. Here's a list of some of the things that we have received since March. And this is wonderful because we've been able to provide services for 750 individuals that we never would have been able to before. These are individuals who are not on Medicaid, who do not qualify for any of our waiver services. Our care coordination program has, you know, like I said, we're only able to provide 320, I think right now, individuals with services on care coordination, and we have a wait list of over 600 people waiting for that program. So these are 750 individuals that we, before COVID, would have never been able to provide services to. Mostly they've all received meals, and then some of them have also received personal care services, transportation, and emergency response units. So we're really happy and fortunate to be able to provide for those individuals. Care Coordination Express. This is one program that we have been offering since the pandemic, and it's for individuals who are over the age of 60, who are in our 4-county area, and who are transitioning from hospital to home. So not only are they, some of them are receiving that coaching event that I talked about before, our transitional care program, but some are not. If they're not on a managed care plan, they wouldn't receive the coaching event, but they would still receive short-term case management and up to 60 days worth of services. And the services that we've been providing to them are personal care, homemaking, home delivered meals, emergency response units, transportation, social work counseling, wellness checks and friendly callers, and caregiver support. So some of our other programs and services that we've been able to provide since COVID are meals and nutrition programs. So like I mentioned before, we have been providing meals for 750 individuals we wouldn't have had any access to before. And we also have a restaurant initiative. So we are currently partnering with some small family-owned mom and pop type restaurants in our 4-county area. And with this program, individuals who call in and who are needing food or needing some meals, if they may or may not be interested in home delivered meals, but we're also offering our restaurant initiative program, which means that they would receive, I believe, a $50 gift certificate that they could use at one of these partnering restaurants. So it's really a neat program that just started about a month ago. PPE. So we have received quite a bit of PPE, hundreds of thousands of pieces of masks and hand sanitizer from the state. And we have provided that to our provider network so that when they're going into the homes of our consumers, they've got what they need and they can be safe and keep our consumers safe. And we've also been creating wellness kits. So it started with 14,000 was our goal, to make 14,000 wellness kits, and now it's up to 26,000. So we've been providing wellness kits across our 4-county area over the last 4 months, and we're still working on those. And what's in our wellness kits are masks, hand sanitizer, pens, magnets, brochures, different resources that's specific to those counties. Some of the kits are for individuals over 60, some are for under 60, and some are for any age. So we've kind of got a lot of different types of wellness kits going on, but they've been very well received so far. Some have little notes in them from some of the medical students from NeoMed. We also partnered with Blick Clinic, who had a lot of their clients write little notes to the individuals that are receiving them, just something to encourage them to say, you know, hey, we're thinking about you, or hang in there, you know, something to make them smile or make them laugh. And those have been really appreciated. We also have technology and online access program going on right now. We have 2 actually. Our initial computer program, we received, we have the opportunity to receive 160 devices from Summit County that will go to Summit County residents over the age of 60. These computers will also come with a MiFi or a hotspot so that the individual can have internet access for a year. And it also comes with some tech support from PCs for People. So this has been a great program, but we figured out along the way that there were a few issues that we weren't really able to resolve the way we'd like to. So the devices are basically desktops. They're fairly big devices. They're really heavy, so they're difficult for us to deliver to individuals. And then with us having everything, hands free and social distance, we have to, leave them in front of the door and then call the individual and make sure that they receive it. Since they're heavy for us, we know they're heavy for our consumers. So we're asking them when we call to schedule a delivery date to have either a family member, a friend, or a neighbor come help them and bring them into the house and set them up. If they live in an apartment building, thankfully the service coordinators and maintenance staff have been helpful at getting those into the rooms. So delivery is an issue, setting them up has been a little bit of an issue, and then some individuals just really aren't very tech savvy, so they've needed a lot of extra assistance, and they really truly would benefit from some in-home, in-person assistance rather than over the telephone. So we did create a manual with some step-by-step instructions on how to do certain things, how to work some of the most popular like Skype or Zoom or WebEx if they want to interact with family or friends or doctor's offices. So for the most part, it's working really well. There's just those few hang-ups that we've come across. Our newest tech program that's beginning here shortly, we will be able to provide up to 500 devices to individuals in Summit County. Those will be able to give a choice of either a desktop, laptop, or tablet. So I think that'll be a little bit easier for individuals to utilize, and they'll be able to choose what works best for them. And we're working with Best Buy, who will deliver the devices, physically set them up, and help them kind of get connected and get started, which is great. And then they'll provide ongoing tech support for a year. So we're hoping that will alleviate some of the issues that we've come across with our current program. Being that we can't go into the home, at least they will have someone actually set up the devices and give them that hands-on support. Our evidence-based classes that I mentioned, the chronic disease self-management, diabetes self-management, matter balance, and Tai Chi. Prior to COVID, we were providing these in person. Thankfully, all except for, I believe, matter of balance have been approved to be online classes. And we weren't really sure how those were going to work so far, but the feedback that I've received is that they are actually going really well. So the individuals do have to be somewhat tech savvy and have the ability to, get on the computer and get on Zoom or whatever. But it sounds like they're working fairly well, and that individuals are still getting a lot out of the classes and really enjoying them. And then I talked about CareCore Express, and then telephone reassurance. So we have a program where we've got some volunteers at our agency who are making well checks, friendly phone calls to individuals who either live alone, or they're isolated, or they just felt like they would really appreciate someone checking in on them and just seeing how they're doing. This has definitely been difficult for a lot of individuals in our communities, being stuck at home and being afraid of going out, or not having people come in like they normally would. And as we all know, it can be very lonely and isolating to be homebound for so long. So I told you at the beginning I wanted to talk about the good, the bad, and the ugly about services. So the good is, are all those programs that I talked to you about, all the different services and resources that we offer and that others in the community offer. That's the good part. The bad part is there are quite a few gaps. So even though we do a lot, there's still so much that needs done. And unfortunately, I read a report from Summit County, and I want to say it was 95% of individuals assume that Medicare is going to cover everything that they need when they are older and they need some assistance. Unfortunately, that's a myth. So Medicare, just a reminder, it's a federally funded health insurance program for individuals over 65, and some individuals are under 65 that have disabilities. So if you're not able to work, a lot of times you're eligible for Medicare. Unfortunately, Medicare does not cover long-term care in nursing facilities, assisted living, adult day services, or daily custodial care, which is like assistance with eating, dressing, bathing, things like that. Now, I'm not here to bash Medicare. It does do a lot of good things, so let's talk about some of the things it does cover. Medicare Part A does cover hospital costs after you reach your deductible. Covers short-term stays in nursing facilities. So like if someone has a fall, they go to the hospital, they go to a nursing home short-term for a few months for rehab, that generally is covered. And then they cover hospice as well, closer to the end of life. Medicare Part B covers costs of doctor's services, outpatient care, and other medical services that Part A doesn't cover, and some preventative services. And then Part D is the drug portion, so it covers some medication costs. So while it does cover quite a bit, it doesn't cover everything. And that's the issue. Most of the Medicare services are short term. So if you're someone or your consumers are individuals who need long-term care services, Medicare is not going to cover, unfortunately. And that's something that I think we all just really need to be aware of. And here's why. This is the ugly. The ugly is not that we're living longer, which we are. The ugly is just that when you see how quickly these numbers are changing, our current infrastructure just can't handle it. We already know that there are tons of people out there that we can't serve because they don't qualify for our programs. And that number is just going to keep getting bigger and bigger. So unless we do something as a society to fix this, to add more services to those who need it, we're really going to have an issue on our hands. If you look at the year 2000, and then look at 2060, the number almost triples of how many individuals we will have over the age of 65. And the other kind of sad news is that the federal budget, as you can see, for the Department of Defense and for the Centers of Medicare and Medicaid, they are increasing their budgets. They are very well funded, which is not a bad thing. I'm not saying we should defund either one. But what's sad is that the Administration on Aging and the Administration for Community Living, which is where the services for older adults come from, the funding for those has stayed exactly the same. And look how little it is anyway. So we're not really getting the increase to match the growth that we're expected to see. And I love this colorful little slide. So if you look on the top right, these individuals are the low income who need some assistance, and they qualify for that huge plethora of services that I've been talking about all day, all of our waiver services and stuff. And so those individuals are happy because they can, they qualify for whatever it is that they need. On the right side, these are like we always joke, these are the LeBron James of the world. These are individuals who have a lot of money, who could privately pay for anything they needed. If they needed 24-hour nursing care, they could privately pay for that. What's difficult are the individuals on the bottom who are kind of stuck there in the middle, who are probably you and I, who are moderate income, who make too much money to qualify for any of the waiver services, but don't make quite enough money to be able to private pay for everything we would need. And there's a lot more of them than anyone else. So this is why it's such a huge deal that, we don't have services for individuals who don't qualify for Medicaid. So that's all I had. Does anybody have any questions?
So we're going to go ahead and I'm going to read some questions that came up. I would like to ask a question first of who was on the phone for attendance purposes. Denise needed to know the number 612-4007 or 4077. If you could let us know what your name is. And then we'll start in, so Patty sent in a question about wondering whether there were adult day service offerings during COVID.
Yeah, so at the beginning there was not. They were shut down for, I'm going to say 5 or 6 months. which was very difficult. And we actually lost one of our adult day providers. They have closed down permanently and will not be able to reopen because they could not sustain during the pandemic. So we're really kind of disappointed and upset about that. Thankfully, the Ohio Department of Aging was able to come up with some ways that the adult day services could assist prior to being able to open again. So there was some funding for facilities that delivered home delivered meals to individuals who normally would have received meals while they were at daycare during the day. They also were able to make well-check like phone calls, call-ins, and they also were able to put together like activity packets and deliver those. So they got a little bit of money for doing one or all three of those activities. But thankfully in September, the governor said that they could reopen. So all of ours are now reopened, but they do have to make sure that everyone's wearing masks and gloves, and they are doing a lot of testing. So each week, all of the staff are being tested, as well as all of the participants. So anyone that comes in is being tested for COVID. And the state has provided some supplies for them, but a lot of it is out of their own pocket that they have to do. So they have to take temperatures and do the COVID testing.
And Doug wants to sort of back up from Area Agency 11, that they've had the same sort of issues over in the Youngstown area as far as adult day and challenges there. And anybody else, if you have questions, go ahead and write them in the chat, or if you want to unmute, you can do that too. I have a comment from Jen Drost. She said, you mentioned the right of individuals to eat what they want in long-term services, despite a physician recommendation. She wanted to know what supports are there for dietary support and education so people can make better choices.
Yeah, this is one of the most difficult things because if someone my grandpa's going through this right now, and they're not sure exactly why, but he had a fall and now all of a sudden he's having trouble swallowing, and they actually had to give him a feeding tube. His throat is really swollen, and he can't swallow things without them getting stuck. And there's a high potential of him aspirating. So he's really upset because he wants to drink things and wants to eat things. And the doctor is saying, and the speech therapists are saying, you really can't because, it could make you really sick or you could die. I mean, it's difficult. But he's saying, I'm alert and oriented. I'm my own person and I know the risks and I want to do this anyway. So if there were an ombudsman involved, they would be advocating for him to be able to make that decision. Some facilities will make you sign something saying, I understand the risks, because that's the difficult part. If the ombudsman's going to come in and say, you have to let this person do what they want to do. But then if something happens to them, it kind of comes back on the nursing facility. Like, this happened in your facility, so they're kind of in a sticky situation. So you understand why they don't want residents to do specific things and why the facility would want them to follow the doctor's advice. So that's a difficult piece for us because we know that we're advocating for them to do something risky and potentially dangerous. But that's the whole role of that program. So yeah, there's a lot of support, especially around nutrition when it comes to nursing facilities and ombudsmen. And I know it's hard because Dr. Drost, you're a doctor, and you don't want us probably going out telling people, you don't have to follow your doctor's advice. But
yeah, she says it's so frustrating because many facilities have desserts with each meal and then treats and snacks.
Yeah.
So.
Yeah. And you don't want to be the one who can't partake in any of that,
So I'm going to ask our participants here to think about again, sort of what maybe was surprising or what you already knew or whatever about the Area Agency. I'm going to go ahead and start with mine because I think it's an important teaching point. Was that slide that Brandi put up with the two people on the sides of the cliff and then the people in that valley, that, we do think that we've got the social systems in place that are going to take care of people. And I'd like Brandi to talk a little bit more about what happens to the people in the valley, like how they end up eventually getting to a place where they can get the spend down and stuff like that.
Yeah, definitely. So we do come into contact with quite a few individuals who don't qualify for Medicaid but are fairly close. So our assessors are really good at, laying out all of the options and saying, for some individuals, it's simply if they have a little bit too much money in their savings account, that's making them not eligible. They might be able to prepay for their burial, and then that all of a sudden is no longer looked at as an asset, and that makes them, qualify, excuse me, for Medicaid. It's really difficult because a lot of individuals have just a little bit in their savings account, and they're trying to desperately to hold on to that because that's their rainy day fund. That's their, if I get a leak in my roof fund. It's if there's some kind of emergency that happens, that's how they plan to cover it. So someone coming in and saying, you need to spend that, and then you'll be eligible for all these other services, that's really hard to let go. And I totally understand. So a lot of times, unfortunately, that's what happens though, Sue, is, individuals will have, because they don't qualify for free services, they have to private pay for what they can. And then once they've spent down far enough, then they generally end up on Medicaid. So one of our big goals is to actually, and it's interesting because the majority of what area agencies do are provide services that Medicaid pays for. But there's also this huge push for us to help people to avoid getting on Medicaid, because we know Medicaid costs a lot of money. It costs the taxpayers a lot of money, and most people don't really necessarily want to be on Medicaid. So we do try really hard to educate individuals on what they can do to, not end up on Medicaid or whatever. And that's why we started the care coordination program. But like I mentioned before, unfortunately, there's just not a lot of funding for that. And I'm going to shamelessly do this plug here. So Ohio has 88 counties, and last I heard, 80 of the 88 counties have senior service levies. Unfortunately, in our 4-county area, Summit, Stark, Portage, and Wayne, we have no senior service levies. If we did, we could help so many more of those individuals who are in that crack, who are in that moderate income level. That's how the rest of the state is doing it. So that's something that we've been really passionate about, and we are hoping to, get at least in Summit County, in Portage County, we're doing a little bit of work to try to get a levy at some point in the near future, because really that's the only way that we can help those individuals who don't qualify for Medicaid, and hopefully divert them from Medicaid. Oh, Doug, I'm jealous. He said we just passed the renewal of our levy.
So Doug, tell us what, from your perspective then, with that levy, how does that change things from your perspective?
Well, as Brandi pointed out, the senior levies, and Mahoney County senior levy is the only one that we administer in-house. Our other 4 counties have senior levies, but they're sort of provider run. But as Brandi clearly and accurately pointed out, they really provide that sort of stopgap for people who don't qualify otherwise for waiver programming and other, programming, because their income is too high or their assets make them ineligible, or they have more need than perhaps something like family caregiver support can provide. So we were thrilled. I think Trumbull County was our first biggest one, and that was about 10 years ago. And then Mahoning was, I think, the best one to come through, because we manage that one at Direction Home of Eastern Ohio. So we have a lot more oversight and control and provider backing on that. But yeah, Brandi, you're absolutely right. It's great because we feel like we were able to address a certain segment of population that 15 years ago or 20 years ago or whatever, we unfortunately had to sort of turn away or try to get them hooked up with community services that were unlikely to meet their needs because there just wasn't anything in that middle ground. So yeah, it's huge. And yeah, we just went through a renewal on this latest election, and it passed resoundingly. So, or it was renewed resoundingly. It was a nail biter, I think, at the first go around, and we had to be really careful what election cycle we put it in, depending upon what it might have been perceived to be competing against, you know, other schools, levies, and whatnot. But we got it, and we're thrilled. We've got, I can't remember our exact numbers, but I'm going to give you a poor guess, but I think we're near 1,000 folks who are currently on Mahoning County Senior Levy. We've got 5 full-time case managers who manage that program. And it's everything, as you explained, you know, home delivered meals, emergency response, adult daycare, personal care service. Not quite to the level you might expect in levy or in a waiver, but close enough to make a whole lot of good.
Yeah, thanks, Doug. And you're right, it's so hard to get levies passed because that, you know, you're always up against something else like the libraries or the zoos or kids, you know, and how do you choose between kids and the elderly? It's terrible that we have to make that choice, you know, that we have to choose one or the other and we can't do both. So even though we know a levy obviously would cost us taxpayers money, it's still a lot cheaper than Medicaid. So if we could keep people on the levies and keep them away from Medicaid, it's going to save us a lot of money in the long run. And Sue, I did notice there was another question in here from Parul. So I know this can be difficult, but often get asked by patients if services like Meals on Wheels can provide food to people who have medical conditions like diabetes, hypertension, low heart failure, etc. Yeah, they do actually. I think all but we have 7 meal providers, and I think 6 of them provide special diet meals, including all the things that you mentioned. So yes, they definitely can request special diets. If they're on a waiver of ours, we do pay for those for them. If they're not, they might have to private pay, and it might be a little bit more costly. But there is definitely they do definitely offer those special diets. They even do therapeutic and mechanical, you know, pureed meals, things like that.
So do any of our learners, I'm going to throw it out to you, do you have you had any experiences with the area agency? Did you know anything about the area agency prior to this session? Somebody want to chime in?
Hi, I will. I'm Talisha. I am from the skilled nursing world, so I've had a lot of, you know, interaction with area on aging, but I had no idea the amount of community support that you guys provide to, you know, everyone that's just out in the community. So I think it's wonderful. I definitely thought I knew a lot going into this, but had no idea of, you know, the majority, I guess, of what you guys do.
That's great feedback. And you know what? When you guys do your presentation, we'll learn a lot that we didn't know about your end of things too. So that's great. Anyone else, please? How about some of our
Chowdhury?
Go ahead.
So I knew that the area agency on aging existed, and a lot of times have referred patients over, but in terms of the spectrum of the services offered, was definitely not aware of them. And a lot of times, I think what we're looking for is somebody, like Brandi mentioned, somebody to go into the house and just evaluate and give us feedback. And because we, again, as physicians, we can only take care of one aspect of things, and knowing what the other aspect, which is a huge part of it, what's in the house, what's not in the house, what can they get, what they cannot get. So a lot of those things are going to be really helpful. And especially some of the resources you mentioned for Alzheimer's patients, but also for the caregiver. The caregiver part, I absolutely did not know. And often that's the piece that we run into, where it's like, I'm sorry, but I can't offer you anything except a listening ear. So I think that's probably one aspect that we'll definitely be using.
Yes, and if you are participating in the entire geriatric resource certificate program, part of that is actually going to be sitting in on a ongoing team called the CMIT team, Care Management Interprofessional Team, that is a long running collaboration between the health system, geriatrician, pharmacist, and the area agency, where cases are brought, and sort of that interprofessional team troubleshoot. So we're going to offer you guys the opportunity to sit in on a couple of those just to get a sense of really how much great problem solving can go on. And you, if you have, somebody who you're interested in talking about, can bring a case and say, I've actually got these questions, and, the area agency will be at the table to help you solve it. So looking forward to having you have that experience. So we've been doing it for a while, and we all are completely bought into this is the best way to provide care, because you have the in-home point of view, you have the medical, the medication, and all, a way more holistic approach. Thank you. Someone else? How about some of our AHEC students? Does anybody have any thoughts? Did you have any awareness at all of the area agency or the types of supports they offer?
I'll talk. I did not. I'm an AHEC scholar. And I was going to say the caregiver support I think is really, really awesome as well. I'm an exercise science student, so I thought it was wonderful to hear about all the health and wellness opportunities you offered. I think that is really, really important. And the Tai Chi, I know that really helps with balance and, improves their confidence. And it's really important for them when they're at home and, their confidence so they don't fall and things like that. So I had no idea, but it was an awesome presentation. Thank you.
That's one of the most fun things that we do.
That's great to know that, in your upcoming profession, that you'll have that in the back of your head, that, if you've got somebody who maybe can't afford, a Y membership, or, some of the things you might be recommending, that would be a resource that you would have there in your head to say, maybe the area agency can help me out. So that's our goal.
I have a question for Brandi, and maybe you do not provide the service, I don't know. How about instances where you're not really suspecting elder abuse, but just that people maybe are not cared for in the best possible way they could be at their home? Is there anything that you can do in those instances?
Yeah, so a couple different things. So we are always kind of on the lookout for potential abuse or neglect or exploitation. And we work really closely with Adult Protective Services. So if we do have any suspicion, we are mandated reporters. So we do make referrals to Adult Protective Services if and when necessary. But also what we have found, honestly, is just having services in place, having a home health aide that comes multiple times a week, or having, home delivered meal provider that brings meals every day. Just having other individuals around is very helpful in, obviously they're laying eyes on the individual so they can let us know if there are any issues right away. But it also is kind of a deterrent. If you're a family member who, maybe has a tendency to not want to take care of your loved one, but someone's in the house all the time, it's a little more difficult, I think, to treat them poorly, because there's someone who's there, who's watching, who's kind of holding you accountable, who could, call Adult Protective Services and whatnot. Obviously things still happen, but for the most part, we've heard of a lot of situations where things got so much better once we put services in place. And a lot of times it's not even that there was malicious intent, but it was just that the individual was too stressed or worked, or, was too busy to provide the type of care that needed to happen. So there might've been some neglect there that was just, unintentional, but then having some help in there has, been very helpful as well. So does that answer your question?
Yeah. And that's partly the secret agenda sometimes that the physicians have, that they cannot come out and say to, but yeah. It's not abuse, but there's definitely things could be better. So sometimes, just like you said, having a person coming in, and a lot of times when we get resistance from patients saying, no, I don't want somebody into my house, that is something that sort of can put our red flags up even more.
Right.
I have one more question. Sorry, bunch of questions today. What services, especially like some of the activities and stuff that you mentioned, for people who have mental health issues? I mean, and a lot of these questions are coming because I have sort of patients in my head that I'm thinking about. People who are living independently, or not, are living with a caregiver, so they can do their basic ADLs, but not more than that. So can they go to some of these places and do activities, and if sort of like a behavioral outburst happens one time, can they be allowed back after things are more stable and those sorts of things?
Yeah. So I don't believe adult day service is available through our SRS program, which is the Specialized Recovery Services Program. So that's one thing that I think is kind of unfortunate, is that the majority of the individuals that are able to go to adult day services are the over 60 population. So, and of course we do have individuals over 60 who have mental health issues. So they can go to adult day centers. There have been times where behavioral issues have kind of interfered, and we've been asked to, find another place for them to go. But thankfully, since we have multiple agencies, we're able to, find another place for them. But with our SRS program, which is generally a little bit younger population with mental health issues, so even though they might not be able to go to like a formalized center like that, there are support groups and peer-led meetings and stuff that they can go to. So that's about all that we offer on our end, but we are cognizant of other, mental health agencies out there, and we will link them with other entities for other opportunities. Like I know the Blick Center is excellent at getting people involved who have behavioral health issues and stuff, and they have a center where they can go and do some real work. Like they, help other agencies with filing and with shredding, and they've been helping us put together the wellness kits, which they love. So, just kind of linking them with whatever resources we can find.
Perfect, thank you.
Yeah.